Rotator cuff tears are common among active adults, but I found them to be very common among military veterans. Very often they result from trauma that occurred during active duty. In this video, I explain the injury, what the signs and symptoms veterans often experience. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Now, rotator cuff tears, just so you know, and you may know this, but they're very common injuries, and I just want to explain what they are. They're injuries typically of the tendons of the muscles off your shoulder blade. And there's 4 muscles and tendons of the rotator cuff, 3 off the back of your shoulder blade, 1 off the front. They attach to basically the tip of the ball and socket joint, what we call the proximal humerus. And what those muscles and tendons do is they stabilize the ball in the socket while you reach up overhead, out away from your body or behind your back. Now, these are usually overuse injuries as we get older in our 50s and 60s, doing a lot of overhead activity, tennis, golf, lifting objects for your work, whatever it is like that. But what I see in the military is they're very often a result of a traumatic shoulder injury while they were in service. Now, the etiology of rotator cuff disease is multifactorial. A lot of times it's not just trauma or micro trauma, repetitive use, but there's age involved and things like that. But there was a good study not too long ago that showed specific traumatic event, acute event, it can very often cause a rotator cuff tear. And again, that's what I see a lot of times in members of the military and then when the veterans reach out to me. What the researchers figured out is that a simple fall can cause an acute rotator cuff tear, even in young individuals. Landing on it, falling and sort of landing on another option or another object can definitely do it. Also, the stresses that occur within the rotator cuff during an attempt to cushion a fall, like putting your arm out, can definitely exceed the tensile strength of the tendon fibers and cause a partial thickness rotator cuff tear or a full thickness rotator cuff tears. And I've talked about in a number of videos from my other YouTube channel, rotator cuff tears typically don't heal on their own, especially if you don't get surgery early on. They can become much bigger tears and much more problematic tears as you get older. So a veteran usually, at least in my opinion, can very successfully argue that that traumatic injury during the military, especially if you've got evidence that you went to medical and got seen and there's evidence of it, you can very often tie it to the development of rotator cuff tears in a Nexus letter, so to speak. Okay, if you have ideas for other videos and topics for other videos for this channel, whether it's injuries like rotator cuff tears, risk factors for injuries like this video, specifics about Nexus letters, DBQs, or anything else, leave those in the comments below. Please subscribe to my channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below this video. You can learn more about working with me and working with my team. We try to make the process simple. We try to make it quick for you, as quick as we can. And I try to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to helping you.